So, dear viewers, I am Dr. Rakesh Gupta. I am President and Director of Public Health Strategic Institute for Public Health Education and Research. And I'm former Director of Services Punjab. Doc Plexus is here with a new episode on guidance on the treatment of hypertension with medications by lifestyle modification on the occasion of the World Hypertension Day 2023. We welcome you all for the session by Dr. Jaswal. He is Director and Head of Department Cardiology, Director Cardiac Cath Labs at Fortis Hospital. It is in Mohali, Punjab. So World Hypertension Day, it is celebrated every year on May 17th. The theme of this World Hypertension Day is measure your blood pressure accurately, control it, and live longer. So we have with us Dr. Jaswal, and he is MD Medicine, DM Cardio from PGI Chandigarh. He has an experience of 29 years and is specialized in the field of interventional cardiology and has already completed over 20,000 coronary interventions. He regularly organizes international workshops on complex P.C.I. and regular teaching workshops of 2 to 3 days duration for 5 to 10 years post DM practicing cardiologist in the teak of Rotablation, complex bifurcation stenting, FFR, and intracoronary imaging. He's a member of the Fortis Medical Council, which comprises of senior clinicians to support Fortis' mission of clinical excellence, distinctive patient care, research, and education. And his areas of interest are transradial interventions, precision P.C.I. in complex coronary artery disease, developed center of excellence. So, Dr. Jaswal, you are welcome. And I may let all the viewers know that he is a very popular cardiologist nationally as well as internationally, one of the topmost cardiologists. So we will have some questions for you, Dr. Jaswal. So I think I will stop sharing. Yeah. So Dr. Jaswal, will you let us know what is exactly the correct method of measuring blood pressure? It's a very simple question, so it will benefit both the patients as well as the young doctors.
I think that's a very, very important question. Yeah. First of all, even before we go to that question, I would like to mention that, blood pressure or hypertension is a silent killer.
Right.
Why it's a silent killer? Because it doesn't produce any symptoms. Mm-hmm. But over a period of time, it damages 5 organs in our body. One is your brain, sudden bout of hypertension, and there can be intracranial bleed. It can affect your heart, coronary artery disease, hypertensive heart disease, heart failure. All these complications in the heart can happen because of persistent long-term hypertension. Retinopathy, internal part, it's your field of the eye, can be affected by hypertension. Similarly, kidney disease or hypertensive nephropathy and gangrene peripheral vascular disease. These are the 5 organs which are affected by hypertension. Therefore, it's very important for us to precisely measure the blood pressure and as per indications, treat it. Treat it without medical treatment, lifestyle modification, because this is basically one of the lifestyle diseases. And this is because of the faulty lifestyle. So you have to correct that. So first thing is the diagnosis, for which correct method or blood pressure recording is something which every patient must know. There's a lot of controversy around, which blood pressure should be relied. Is it the blood pressure which is recorded in the clinic setting is reliable, or it is the home monitoring which is more important, or the ambulatory monitoring? And it is found that, the clinical blood the blood pressure recorded in the clinic of the doctor is normally on the higher side and may not truly reflect the actual blood pressure. The reason for that is the white coat hypertension, the stress on the mind of the patient. He's not in an comfortable environment, and he might have come running to the clinic because he might be getting late for the appointment, or the pressure of day's schedule. So it is seen that the home monitoring of blood pressure is probably the most reliable method to diagnose and quantify blood pressure. But then the only downside is that people at home, they do not know how to record blood pressure. And little error in the method of blood pressure evaluation or measurement can make big differences as far as the readings are concerned. That is why I think this question is very valid, that everybody, doctor should also be able to teach his patients to know how to monitor blood pressure at home. And we have now plenty of recognized blood pressure operators across the globe. And some European brands have been internationally recognized as the most reliable and standardized methods of blood pressure recording. So how it should be done? First of all, where the cuff should be inflated, the selection of cuff, how large should be the cuff. The width of the cuff should be at least 2/3 the length of the arm, so that it covers most part of the arm. Secondly, the tubing, it should be directly on the brachial artery, so that the exact pulsation are immediately recognized. And then as you turn to the cubital fossa or the forearm, the diaphragm of the stethoscope should be kept right on the cubital fossa where you feel the pulse. So that is how the position is to be made. Arm should be absolutely relaxed. The blood pressure operators as well as the arm should be at the same level for right measurement of blood pressure. Now, the person or the doctor who is measuring the blood pressure, he keeps one hand's fingers on the radial artery and starts raising the pressure in the cuff. And once the pulse disappears, he further raises by another 20 to 30 millimeter of mercury. That is where you switch over to stethoscope, keep it on the brachial artery to hear the sounds, Korotkoff sounds, and then you slowly start releasing the pressure. And how slowly? That is also defined. It should be 2 to 3 millimeter per second. What happens if you make it too slow? In that case, because of the venous congestion, your diastolic pressure can be erroneously recorded high. On the contrary, if you drop it too fast, both the systolic and the diastolic pressure, they will be underestimated. Thirdly, if your cuff size is inadequate, very obese patient, and you are using coronary cuff, in that case, also there can be underestimation of the blood pressure. So by and large, looking at the girth of the arm, you have to look at the width of the cuff, which should be at least 2/3 the girth of the arm. Right BP apparatus, right way of evaluation of blood pressure, and it is highest. Diurnal variation shows that the blood pressure is highest in the early morning hours.
Yeah.
One reading should be early morning hours, and then you must recognize or try to understand, what are the diurnal variations. Sometimes in the afternoon also you take another reading, sometimes in the evening, and sometimes at night as well, so that you have a complete 24 hours profile of your blood pressure, and accordingly the decision can be taken about the start of treatment. But before start of treatment, as we will be discussing in detail, majority of the blood pressure patients, they can be managed without medications.
Okay.
By lifestyle modification, because I mentioned right in the beginning that this is a lifestyle disease, and once you correct your lifestyle, then definitely the cause is corrected and the blood pressure may stay normal.
So, Dr. Jaswal, before we go on to the lifestyle modifications, I may just ask you, is that electronic, those BP apparatus, are they okay for screening purpose, maybe, or for home checking of BP?
Yeah, I think there some of them are reasonably fine. And there is one imported one by the name of watch BP at the rate of home.
Okay.
That is very, very reliable. And there are BP apparatuses which take 3 readings and then give you the mean. of
Okay.
3 readings, which are quite reliable, as good as the mercury manometer.
Can you mention the name again? Watch the BP.
Home BP at the rate of blood pressure. Home monitoring at the rate.
Home monitoring at the rate of BP. Okay. Okay. So that is good. And I must confess that nobody actually made us learn about the technique of checking BP. So in our during our MBBS. So I'm sure that young doctors and the patients as well, they will benefit from this talk. So the next question,
This is one of the most ignored
I know.
and understated kind of subject to blood pressure recording. You know? And if you look at the Hearst textbook of cardiology, there is a full chapter which has been dedicated to this aspect.
That is great, yeah.
Unfortunately, because that doesn't fetch much marks, so probably this part is most of the time.
Yeah. So you can now continue with your talk about controlling BP without medication and with the lifestyle modifications.
You see, day in and day out, we learn from our patients their heartfelt feeling that they don't want to be on medications for the rest of their life. Second belief is that if we start medications, we'll be on medications for the rest of the life. I want to clarify 2 things. One is in grade 1 and 2 hypertension, you don't need to start with the medication state. First of all, you give a trial with lifestyle modification for 1 to 3 months. Keep recording the blood pressure, and if it is persistently high, then you have to start medication. And you will be surprised to know if you religiously, do all lifestyle modifications, the blood pressure control which can be achieved with lifestyle modification after 3 months is as good as a blood pressure control with combination of 2 antihypertensive medications. So the advantage is, one, many patients may not need medications at all for their blood pressure. Second, even if you need it, instead of 3 or 4 medications which are required to control the blood pressure adequately, you may do well with 1 or 2 medications. So your overall pill burden would be much low. So that is why I have picked up this topic, the non-pharmacological strategies for management of blood pressure. And if we all doctors, we educate our patients about these strategies, I think they'll be greatly benefited as well. So the basic 7, parameters which we consider in lifestyle modification is the diet modification, salt restriction is number 1, body weight reduction, smoking cessation, exercise regular, alcohol restriction, stress management by various methods, and minimizing air pollution. These are the 7 things which are modifiable risk factors for hypertension, and they should be exercised in every patient. So let's have a view on each of them one by one. So first of all, diet modification and salt restriction. Normal requirement of the body for common salt, sodium chloride, in our body is about 5 grams. So if you take less than 5 grams of blood pressure of salt per day, your blood pressure will drop between 2 to 8 millimeter of mercury, depending upon how salt sensitive the individual is. But the irony of it is that all across the globe, people use very high amount of sodium chloride. Average daily consumption of salt in different parts of the globe is 9 to 12 grams. And if you look at the Indian data, ICMR data says that average Indian consumes 13.8 grams of salt per day. And highest is in our region, in North India, 14.1 grams per person per day. So when we are taking so much of salt, 50% of the general population is salt sensitive. So naturally, the probability of one developing hypertension is very high, and the incidence of hypertension in that particular community would be rampant. So that is, but at the same time, what I have seen is that educated people, they are so conscious about salt that they start getting admitted to the hospital for hyponatremia, low sodium level, which is again harmful. So it is said that if you take less than 3 grams of salt per day, again your mortality risk increases. So it's called a J curve, right? Risk again rises. So it should be less than 5 grams per day, but should not be less than 3 grams per day. So that is one important thing which has to be kept in mind. The second thing is about the diet. What things contain a lot of sodium chloride? Pickles, papad, chutney, chips, packaged namkeen, right? Your soups, your preserved foods, anything which contains baking powder is rich in sodium chloride. So all these foods should be avoided. Extra salt on the table should be avoided. Your normal cooking should have moderate amount of salt. That gives you the right amount of sodium chloride, which is 5 grams per day. Other constituents of diet, there are two common diets which are known to reduce your blood pressure. One is the DASH diet, what we call as the dietary approaches to stop hypertension, and the Mediterranean diet. And if you look at the constitution of diet in these two types of diets, you will recognize that the constituents are virtually the same. They all advise high fiber intake, good amount of vegetables. They advise fish, bufa in large amounts, and olive oil without using it for deep frying. That is only for salad dressing. Diets which are rich in calcium, magnesium, phosphorus, and potassium. They are all known to decrease your blood pressure. Whole grains. So if you are using bread, use brown bread. And unrefined flour. Don't use maida. Whole flour should be used. Similarly, legumes intake should be increased. Saturated fatty acids and trans fatty acids, they should be avoided as far as possible. The common sources are your animal sources, dairy products. So among dairy products, we should not be completely banning them, but it is low fat dairy product which is advised for vegetarians at least, and full fat dairy products should be avoided. Red meats should be avoided. These are the sources of saturated fatty acids. And for trans fatty acids, you must avoid dalda ghee. For saturated fatty acids, again, desi ghee and your butter should be avoided as far as possible. Similarly, coconut oil is another source of saturated fats. And trans fatty acids, deep fried articles in any oil, with every frying, the food becomes richer every time that oil is reheated for deep frying. So this should be avoided. Dairy products, I've already mentioned that high fat dairy products, cakes, creams, they should be avoided. And of course, chips and your fried food, these are all bad fats. So these are the constituents of DASH and Mediterranean diet, which should be taken into account. Another important recent finding is, which is good for people who love coffee and tea, that coffee in moderation and tea again in moderation, both black as well as green, they are supposed to be good as far as the blood pressure is concerned.
Okay.
So these are some of the recent, dietary things. Any question regarding diet? Cross question which you want to, you want me to answer before we move?
Actually, you can talk more about trans fats. So since government of India is also very being strict about this trans fats, so you can talk more about what food products.
I'll give you the basics. I'll tell you about the trans fatty acids.
Yeah.
You see, even an olive oil which is so rich in mufa and pufa, if you use it for deep frying, The moment it reaches its steaming point is when you can see the steam emitting out of the hot oil. That is the stage at which this MUFA and PUFA also start getting converted into the trans fatty acids. So any food which is deep fried is rich in trans fatty acids. And if you use that oil repeatedly for frying, as it happens in when you purchase something fried from the bazaar, so the same oil is being used throughout the day for frying different kinds of foods. So every time, so the person who gets the fried food right in the evening, he gets the maximum trans fatty acids. Similarly, your bakery products, they're baked at such high temperatures that whatever fat is there, and if you know, there is a lot of makhan and ghee which is put in bakery products. So all that is converted into trans fatty acids. People sometimes say that we hardly take anything. At best, I take 1 or 2 ras with tea, not realizing that ras is very contains very high amount of trans fatty acids. So this is something which has to be kept in mind. Pizzas and all fast foods. That's why it is said that the fast foods, they kill fast, because their fat constituents are very, very unhealthy.
So back to nature is the formula for healthy life.
Yes, definitely. The second important thing is your weight reduction. Your weight should be ideal. And give you a rough idea how the ideal weight can be achieved is your height in centimeters minus 100 gives you the ideal weight. It is plus minus 5%. But on the whole, it is said that if somebody is 6 feet tall, the maximum allowed weight for him is 80 kg. So depending upon your height, that's a rough formula. But the finer point is you calculate the BMI. There are multiple formulas and apps which give you BMI. When you just 2 denominators, your height and your weight, you get your BMI. But the thing to be remembered is for all ethnic groups, normal BMI is 20 to 25. While for people of Indian ethnic origin, in particular, and Southeast Asians in general, the recommended BMI is 18 to 23. So it's on the low side because we are small frame people. Similarly, the waist size or waist circumference at the level of your umbilicus is 32 inches or 80 centimeters for females, and it is 36 inches or 90 centimeters for men. So that is what should be the ideal weight. And does it help? If you do regular exercise, you restrict your diet and lose weight, every 5 kilograms reduction in weight reduces, both systolic and diastolic pressure by about 4 millimeters of mercury each. Simple one, lifestyle modification of achieving ideal weight. So that is all about weight. This is how it helps. And let me tell you, when we are talking about hypertension, we are virtually talking about the benefit which is offered in all NCDs, non-communicable diseases or lifestyle diseases, which includes diabetes. All these factors help in diabetes, hypertension, reducing your cholesterol, reducing your risk of stroke, reducing your risk of heart disease. So multi-pronged benefits of all these things which we are discussing today.
And even with if you maintain your weight, the chances of cancer also diminish, I think.
Yeah. Multiple, but as far as all NCDs, with healthy lifestyle, non-communicable diseases, which are age-related diseases, and their incidence and severity decreases when you healthy lifestyle. The third aspect is smoking cessation. Goes without saying. See, Dr. Rakesh, you must be remembering from our MBBS days. In medicine, one risk factor we always used to say in every disease which we were discussing in our exam. Smoking, without fail, you say you cannot falter. It affects every system. So if by default you give one risk factor as smoking, you are likely to score 1 point. It is so dangerous. So I don't need to mention anything more than smoking. Only thing I want to mention here is many people come and say that we smoke BD. We don't smoke cigarette.
Oh.
Cigarette, BD, cigar, even chewing tobacco,
Yeah.
equally harmful. You cannot escape even one type of tobacco.
Yeah, even the hookahs.
Hookah, everything. And anyway, even e-cigarettes.
E-cigarettes.
Even e-cigarettes, they are also not good. And even passive smoking, what to talk about active smoking, even passive smoking is also harmful. And there are medical ways. The best way to stop smoking is to develop a willpower.
Yeah.
But then if you cannot, you have help. You can take the help of medications like nicotine replacement therapy, skin patches, chewing gums, lozenges, or very clean tartrate or bupropion hydrochloride. There are multiple medications which help you with the habit. So probably if you are determined to do that.
Yeah, Dr. Jaswal, I would like to, I want you to elaborate more on smoking because we have World No Tobacco Day in this month on 31st of May. And I think all healthcare professionals, they should promote this tobacco cessation. So what do you say about that? And what is your message for World No Tobacco Day?
See, as far as tobacco cessation is concerned, it is mandatory. It's a social ill which leads to medical emergencies.
Yeah.
And it is such an important thing, at least from my specialty point of view. The cardiovascular effects of smoking, they disappear after 30 months. If you stop smoking today, your risk of developing heart disease or recurrence of heart disease or complications due to heart disease are as good as a non-smoker only after 30 months after you have stopped smoking.
Yeah.
So earlier, you stop using tobacco in any form, the better it is. And every type of tobacco, including chewing and smoking BD, cigar, e-cigarettes, everything should be stopped.
Yeah.
And let me tell you, this is different from alcohol because nicotine leads to habituation.
Yeah.
It doesn't lead to addiction. So it doesn't affect your organs if you suddenly withdraw it. So if you are strong enough to withdraw it, you can withdraw it without any somatic complications. So that's an important message because you can suddenly drop it. And I have seen that my cardiac patients who are determined to stop smoking, they stop it altogether, all of a sudden, and that's the only way to stop it. If you feel that you have to decrease it for some time and then stop, it never works.
Yeah, that is not possible actually.
Yeah. And then there is always a tendency towards, going back to that habit.
Yeah.
Once your motivation is gone, once you become healthy again, which is the biggest blunder you can do. Once you have decided, with every passing day, you are going to get a feel-good factor.
Yeah.
Why? Because your oxyhemoglobin level increases, your energy level increases, right? You have multiple benefits and you start feeling good. And after, an year or so, you start feeling that you had been doing some kind of stupidity all these years, which had stopped long ago. So that's the message. I think the earlier you realize, the better it is.
And I like to just add that electronic cigarettes, that actually it has been banned since 2019 in India. And that's a very good thing actually. Only just 40 countries have banned it. And India's act, that the PCI 2019, under which it is banned, is one of the most comprehensive acts all over the world. It's being appreciated. But the thing is that it is not being enforced to that level, what we expect. The only problem is that people, even the psychiatrists, they think it can be used for tobacco cessation. So I think that message should go. Yeah.
It's not for tobacco cessation. As I mentioned earlier, it is the NRT, nicotine replacement therapy, and varenicline tartrate and bupropion
Yeah.
hydrochloride, these are the 3 recommended drugs for
So you
helping
mean
with
only the FDA approved drug should be used, not the.
yes, FDA approved drug. And the most powerful approved drug is your internal bill.
Right.
Without the help of medications, you can stop. You can, you can, go ahead with the cessation of smoking.
Yeah, actually, since you are a cardiologist, patient come when they are already afflicted by a cardiovascular disease. So it is easier to quit at that time when you promote tobacco cessation. But otherwise, it's not that easy. So I think people may need advice of a specialist also, tobacco cessation specialist. So I think that only behavioral therapy sometimes that doesn't work. So we need this nicotine replacement therapy or sometimes pharmacotherapy as well.
I'll tell you my personal experience.
Yeah.
Sometimes it works other way around.
Hmm.
You are my old friend. We know each other from college days. You know, I had been smoking heavily.
I know.
And when I was practicing as a physician, one of my patients who was suffering from chronic COPD, getting admitted again, he used these words. He said, Dr. Jaswal, you are young at the moment. You do not know what harm it is doing.
Yeah.
And by the time you reach my stage and realize, what harm it has done to you, there is no point quitting it.
Yeah.
So instead of me telling him to quit, he told me to quit.
That is great.
I took his advice seriously.
Yeah.
And that was 32 years ago.
Yeah.
And I'm recalling his advice because it had come from a person who was suffering because of smoking.
Yeah.
And how he changed my life by motivating me.
Yeah.
So we all must motivate people who are smoking to leave it and then feel the benefit and lead a good quality life.
Yeah.
That's the importance.
Yeah. Good.
अब कुछ लुटा के होश में आए तो क्या? Or once it is done, then you can rectify or decrease the problem. You cannot evade the problem.
Yeah. So I may tell all the viewers that he's actually walking the talk. So he has already left smoking much earlier. 32 years ago, he said.
Oh, yeah,
and he's a teetotaler, and he's in the habit of doing the morning walks regularly, and he maintains his weight also. So that is a great thing. So you can motivate people to follow these guidelines.
Yeah, for sure. Yeah.
So what other factors you want to speak about?
Another important thing is exercise. Exercise which helps us, achieve good health. And there are 3 types of exercises which are recommended. One are the aerobic exercises. Aerobic exercises are those exercises in which your heart rate and breathing rate increases.
Yeah.
And whatever metabolism is occurring, it is aerobic. It is not anaerobic activity and metabolism. Examples are even raking, leaves can be a kind of, aerobic exercise, mowing the lawns, gardening, scrubbing the floor, active sports like tennis, basketball, climbing stairs, walking, jogging, cycling, swimming, dancing. These are all aerobic exercises. And it is proven beyond doubt that if you do aerobic exercises for 30 to 45 minutes a day, for good 5 to 7 days a week, they have a great beneficial effect on your cardiovascular system as well as in preventing, lifestyle diseases. And if for some physical disability reason you are not able to do 30 to 45 minutes of walk, then 3 bursts of 10 minutes activity are equally beneficial.
What do you mean by 3 bursts?
10 minutes each.
Okay.
Walk for 10 minutes. Take rest.
Then take some rest. Okay.
Take a breather. Again 10 minutes.
Okay.
Take more rest, and then third time again 30 minutes, 10 minutes. Right. So that's how you can complete your exercise. You don't have to torture yourself.
Yeah.
But keeping within your own physical capacity, you should preferably be doing 30 minutes of exercise, and this alone can reduce your blood pressure from 4 to 9 millimeter of mercury, depending upon individual response. Aerobic exercises. And another thing is, as far as the exercises are concerned, even your static exercises are also extremely helpful. There are two types of exercise, like dynamic resistance exercise, like weightlifting. Earlier it was said that, resistance exercises they increase blood pressure, but now recent findings have clearly shown both the dynamic as well as isometric resistance exercises. They also significantly reduce your blood pressure and offer you benefit apart from blood pressure, also in diabetes and all lifestyle diseases. Earlier it was thought that, the resistance exercises are good for strengthening the muscles, but they do not offer you cardiovascular benefits. But now it is proven that, dynamic exercises, dynamic resistance exercises like weightlifting and isometric resistance exercises like, doing planks, squatting, and other things like, pushing against the wall. These are all isometric resistance exercises. They also significantly help you as far as outcomes of hypertension trials and CAT trials is concerned. Another important aspect is that nowadays it is mentioned that you must do combined training, because if you combine both the resistance exercises as well as aerobic exercises, the beneficial effects are multiplied several-fold. So for best thing outcomes, it is the combined exercise, what we call as the CT approach in the same training session, which is followed. And earlier it was thought that the moment you stop doing exercise, the benefit disappears. It is proven beyond doubt that there are permanent changes which happen in our cardiovascular system. And if you do long-term exercise, they have permanent effects. And these permanent effects are due to high levels of nitric oxide, prostaglandins, low levels of sympathetic nervous system activity, see what we call as the athlete's heart, the modulation of RAS system. These are permanent, even vascular changes, the vascular length increases, the vascular volume of caliber increases in people who do exercise, regular exercise. Even new vessels are formed, what we call as the new angiogenesis. And all these factors, they decrease the peripheral resistance, and therefore they permanently reduce the blood pressure for the rest of your life. So there are long-term benefits also of exercise. So I think we had in-depth discussion on exercise. It goes without fail that we must do regular exercise.
Yes.
We all are Punjabis, and I think we have heard it several times, Chalda Shrir Loha, te khadya Shrir Goa. So as long as you are doing regular exercise, you are benefiting yourself.
So you want to talk about any other lifestyle modification?
Yeah. Alcohol is another thing. Alcohol should be.
Yeah. That is, I think, important for Punjabis especially. No?
Yeah. There are small studies which probably mention that small amount of alcohol is good for heart and whatever, but these are only small studies. There are large studies from India also, including the ICMR study done by Professor K Reddy from All India Institute, who was later on, director of ICMR also. And it has been found that alcohol was not found to be cardioprotective in any group among Indian patients. So alcohol, particularly binge alcohol, is known to increase your weight. It is known to increase your blood pressure, increase cardiovascular risk. So it must be stopped. And why these studies came? These studies came because there were observational studies from some European countries that people who take more alcohol, they have less incidence of coronary artery disease. It's a long story. There was a concept of red wine versus the white wine, that red wine is beneficial, red wine is beneficial, white wine is not. But bottom line was that French people among Europeans have the lowest incidence of coronary artery disease. And careful analysis showed that it was not the alcohol which they take in the evening in form of red wine, but it is the accompaniments which we take with it, which are good for heart. Like they don't use any fats in their breads, so no chance of trans fatty acids. They're very hard to, chew and swallow. Secondly, they take a lot of vegetables and fiber diet. On the contrary, what we Punjabis take with alcohol, chicken, pakoda, fried articles, namkeen, these are all bad sources of trans fatty acids as well as high salt intake. So it was probably the accompaniments which were benefiting them rather than the red wine. So this was called French paradox. So don't go by those small studies. And if you look at WHO statement, what they have mentioned about alcohol, they have said if there is no contraindication to alcohol intake, like if there is no cirrhosis already, which has happened, one is not overweight because alcohol is pure carbohydrates and they will add to your calorie intake and therefore gain in weight. If there is no contraindication to alcohol intake and the person is used to taking alcohol, then small amount of alcohol, 1 ounce, 30 maybe probably good for heart, going by small studies. But at the same time, alcohol cannot be recommended as a medicine to reduce heart disease.
Right.
While we take a clue from just one part of this statement and we say, okay, fine. If you take alcohol, you'll be free of heart disease, which is absolutely incorrect.
But the latest studies, they do mention that even moderate amount of alcohol is, even small amount of alcohol is bad for heart.
Yes, that's what I'm saying. In Indian patients, every study has showed that in every category of Indian patient, even a little amount of alcohol is not good for heart. Therefore, it is not recommended for Indian patients. So that is about alcohol intake. Stress management is another thing which is very important. There are multiple ways to reduce your stress, which includes your yoga, particularly your Shavasana is something which is proven to reduce your stress levels. It leads to stimulation of your part of the brain, forebrain, which generates endorphins, which are stress busters. Meditation is another way. Again, prefrontal cortex, when you concentrate here, meditate for 15-20 minutes, then your endorphin levels increase. Devotional music, classical music, prayers, regular physical exercise, laughing. You must have seen so many laughter clubs. They have a reason. They also are known to reduce the stress. Sharing your thoughts and stresses with spouse, friends, near dear ones. That's why people who are more social, who remain busy with, other human beings, they are less at risk of these problems because we human beings are basically social animals. So if we remain isolated, then the risk of heart disease in us would be much more. So that is the way to manage stress. I'll narrate you one very interesting incidents. I had a Punjabi folk singer, very popular, who had heart disease in a relatively young age. And I fixed his arteries in 2003.
Okay.
Since I do radial, so after 3 hours, he was fit for discharge. So when I went to give him the discharge slip, he gave a small piece of paper to me in an enclosed envelope. He said, "This is message for your other patients."
Okay.
And what was written there was, "Dil khol lo yara naal, nahi to Dr Jaswal kholange uzar."
That's good.
That is the message of.
That's a good one, actually.
sharing your thoughts, right? Again, a poet, creative person, you make him sit idle for 3 hours, he gives you a good verbal advice. So that's how, the stress management. It's a chapter in itself. I don't think we would be able to cover it here, but definitely it helps. and controlling air pollution, for which the entire society is responsible and it should play its part, is definitely something which is very important from health point of view. At an individual level, there are few trials with the air purifier which you use. But if you are dominantly indoor person, you may be benefited. In any case, you have to go outside also and you'll be exposed to pollution. So unless at a societal level we do something for pollution, this factor is partially modifiable at individual level and not wholly modifiable. And end of the talk, Mool mantra to control blood pressure and lead a healthy lifestyle without medicines is eat less, eat light, eat right. At the right. Walk more, sleep adequately, and most important, smile. Remain happy, and you're good to go. That's the moment.
Thanks a lot, Dr. Jaswal, and it was an absolute pleasure talking to you, though I'm a very close friend, but we were not able to talk so much like today. So, and it was a very well presented session. And so this session that comes to an end, and I'm sure that our patients, hypertension patients, our young doctors, they will definitely benefit from the talk. And a part of it, I will also play for our campaign, World No Tobacco Day campaign, about the tobacco part. So that I'll just take a snip out of it and I'll play on that day also. So thanks a lot.
I will again the message to all our listeners, our doctor friends.
Yeah.
Colleagues is, that whatever they have learned, they, pass on this knowledge. Hundreds and hundreds of patients. That is how a public campaign starts and the entire society is benefited.
Thank you. And I'll request you to, I'll share the recording with you. I'll share the recording with you, and do share with all your patients and in your social media platforms also. So thanks a lot. Thanks, Dr. Jaswal. Thank you.